Baragwanath Hospital. Let's bring into the conversation now the issue of Gauteng Health. The provincial health department, we know, is still reeling from the Esidimeni tragedy, as we alluded earlier. It's now in a financial crisis and it's also struggling with corruption. Let's discuss this with Section27's Sifiso and Nkala. Sifiso, thank you so much for coming into studio to speak to us this afternoon. So we're all, I think, reeling from the massive judgment that Judge Esidimeni handed down a little over a week ago. And it is a groundbreaking judgment. How do you think it changes the tone of what healthcare will constitute in this province going forward?
Thank you so much. There are many challenges that which are happening, actually are taking place in every province. For instance, I'm formerly in Mpumalanga province. Right now, actually it was last week Thursday, I received an SMS from someone that had someone that was, actually it's a relative, that was involved in an accident. And that person was promised to see the doctor only on the 16th of May. And I just forwarded that message to the CEO of Piet Retief because that thing happened in Piet Retief, you know, between Piet Retief and Ermelo. And those are challenges that which we face every day, whereby people are dying without, or either suffering without having that dignity, you know. And we want to say the justice all the time. And that is what we are so much into, you know, as Section 27, you know.
Just explain something to me, Sifiso, because this did not come out clearly during the Esidimeni hearings. I mean, there was some suggestion that the department was asking for cuts to be made because all departments were going through budget cuts and austerity measures. So I wasn't sure at the end of it whether it was simply a matter of will, that it was decided that people will be moved and therefore they were moved, or whether it really was a matter of budget, of the fact that the health department could not afford to keep those patients in health facilities, state facilities.
The reality is that there was no communication. I was once involved, even personally, we know, in one of the demonstrations from the families before this happened. It was in 2015. I was physically there. And there was no communication amongst the stakeholders, you know. Even the families never knew about what is happening. And that is also what is happening right now. We are, you know, our government is trying to implement an NHI, you know. And there's still no communication as such. You know, the fact of NHI, they are trying to ensure that everybody receives quality healthcare services, quality treatment, and everybody believes, believes in this, and everybody does have that sense of belonging with the healthcare services that which are offered by this Department of Health, you know. But the problem is that if you talk, let me say, to Nehau, to Tenosa, to every other health-related union, you find that they know nothing about the NHI itself. And secondly, if you talk with, or if you talk about, we've got the school's health program within this NHI. That means there are doctors that are visiting the schools, you know, and they check if the child can be able to see properly, if that child needs, you know, to having the specs or the glasses, or to check if the child can be able to hear properly, because you find that most children fail at school not because they do not, they are stupid. It's only because they cannot, hear, they cannot see on the board. But you find that this is not discussed with SATU. I'm talking about South African Democratic Teachers Union, or either other teachers-related unions. And also it's not well discussed also with the parents, you know. And suppose the parents know exactly what is it that is going on regarding this NHI. And I'm so much concerned about the communication, or either the state of, bringing this into the attention of every stakeholder. And that is also exactly what happened regarding Life Esidimeni too, you know. Regarding how do you communicate with everyone that is involved, how to ensure that everybody understands exactly what is happening within the department itself. And it seems as if the implementers are not like having that you know, the thought ahead, or rather the thinking ahead of what could be, what is it that is needed. You know, that's the thing.
So Sifiso, you say it's a combination of that lack of ability to plan. But would you say the Gauteng Health Department is cash-strapped, that it doesn't have enough money to carry out the duties it's supposed to?
There are challenges actually with every provincial department regarding the implementers, you know. For instance, let me make an example. Regarding the NHI, they were provided about 7 million rands to, you know, to do things, you know, as per health required. But you find that they underspent. On the first year, it was 42% underspending. Second year, it was 77%. Third year, it was 48% underspending, you know. So there are such issues regarding the spending. And also we see the things of irregular expenditures, you know, or either fruitless expenditures. What do you say about those things, you know? And it's an issue that which needs to be looked at, you know, if we employed the right people, if people know exactly what is it that needs to be done. I once attended one meeting which was district health management team meeting. All managers were there. And I was very much surprised that it was in the third quarter. But most department had spent at least 45 or either 25%. The least, you know, the department within the Department of Health, the one that which had spent seriously, you know, the minimal, it had spent 15% in the third quarter. And what do you say about such things? And this, you know, they felt so embarrassed having me at such a meeting, you know, and they never invited me into such meetings ever. After seeing that, I feel so bad about it, whereas we've got such challenges within the communities, you know. And it's not about not having money. It's either we spend money accordingly, you know, and we do, if we know exactly what's that we've got to do with this money. That's why we're talking about irregular expenditure or fruitless expenditures within the departments. You know about it, about what I'm talking about, you know, and it's a problem.
Thank you so much, Sifiso. It's interesting to hear an insider's view of someone who sat in those meetings and actually had a look at those budgets in detail. Section 27's Sifiso Nkala. Let's go to KwaZulu-Natal now, where the province's health department is battling poor cancer treatment services.